Welcome, everyone. I'm Dr. Evan Benjamin of Ariadne Labs, co-founder and core faculty of PACT. We're all so happy you're joining us today to learn more about the pathway to accountability, compassion, and transparency, or PACT Collaborative. Our name actually comes from our patients in our advisory council. We asked them what they wanted from a healthcare organization after experiencing harm, and they told us they wanted accountability, compassion, and transparency. Medical harm is a significant challenge in healthcare, and despite our best efforts, we see a lot of harm. The harm contributes to preventable injury, loss of trust, and lasting consequences for patients and families. And its ripple effects often extend beyond the individual, impacting care teams and outcomes and the broader culture of safety. How we respond after harm can impact these ripple effects. When we talk about medical harm, we're not just discussing the physical. Psychological, social, and financial harm can impact patients, families, and providers. PACT seeks to address all of these. When patients are harmed, what they often hear from a healthcare organization is silence. Traditionally, healthcare organizations have responded to harm events with a deny and defend approach that compounds the pain for everyone and further erodes trust and really prevents healing. Research shows that this approach may even increase the likelihood of claims and litigation. There is a better way, however. A communication and resolution or reconciliation program is a patient-centered response that proactively supports patients, families, and clinicians after events. Accountability, compassion, and transparency drive the response, which ensures learning about events and a safer healthcare system for all. Accountability means that someone has accepted the responsibility for the event. They've raised their hand and said, "This happened, and this happened on our watch." Compassion means that the patient will be cared for and that the family will be supported after the harm event. And transparency means not only the free flow of information about the event to the patient and the family, but that there's internal transparency and honest learning about the event. If done well, a CRP shows that claims and litigation are actually less likely and trust can be retained. There is now national support for this process through the CMS patient safety structural measures and other regulatory efforts.
I'm Lauga Sokol-Hessner. I'm core faculty for PACT, and I want to build on what Evan just shared with us by further illuminating the difference between the historical response and the more modern approach using a story. Imagine Miss Smith was admitted to your hospital several days ago with an acute medical condition, and this afternoon her family visits and she tells them that she's feeling worse. Her clinical team tries to diagnose what might be happening as she gets sicker. They quickly start several treatments, and in the midst of it all, a clinician mentions a test that had been performed earlier that day, and it becomes clear that no one had reviewed the results. Soon after, another clinician says to a colleague, "Wait, we didn't want to give that medication." Miss Smith quickly gets sicker, her blood pressure dropping, and soon someone is telling her family that she needs to be moved to the ICU, the intensive care unit. Within a few minutes, she's whisked away, leaving her room quiet, and everyone wondering what just happened. Did something go wrong? Is that why she's now in the ICU? Using a historical response to this event can create a second harm event, leaving the family wondering, how did this happen? Did someone miss something? Is this being investigated? Why didn't anyone explain what was happening sooner? As her loved ones try to piece it together themselves through a fog of anxiety and distress, they may assume now that they need a lawyer to get answers to their questions. Now imagine that when Miss Smith was taken to the ICU, Dr. Jones, a member of the ICU team, supported by the hospital's CRP team with coaching and communication skills, comes to the room to find the family, settles them in a comfortable space for conversation, and tells them how sorry he is that Miss Smith has taken a turn for the worse. He assures them that she's now getting the best possible care and that they will be updated about her condition soon. In the meantime, he wants them to know that they carefully review events like this to fully understand what happened and how it can be prevented in the future, and that he'll be sharing what they learn from the review, although it may take some weeks. He then connects them with a member of the patient relations team who can connect them with support and resources while they wait for an update on Miss Smith's status. With the PACT Collaborative, your organization can be ready to respond with accountability, compassion, and transparency anytime something goes awry during care. It is possible to be better, and that's what we're here to help you with.
A communication and resolution or reconciliation program is a principled, comprehensive, systematic, and compassionate response to harm that centers patients and families. Welcome, everyone. I'm Tom Gallagher, co-founder of PACT and core faculty for this program. So communication and resolution programs include rapid identification of harm events, open and honest communication, care and compassion for patients, families, and clinicians, and then reconciliation through financial and non-financial means when appropriate, and ensures learning and improvement for the system. Research shows that communication and resolution programs and a CRP response leads to better emotional and psychological outcomes for patients and families, and reduces the likelihood that they will avoid the healthcare system in the future. For clinicians, a CRP offers emotional support and provides a structured way for them to talk with their patients about what happened. Organizations with CRPs may see a stronger culture of safety, as well as reduced claims, litigation, and associated costs. A CRP provides a process for continued patient-centered care after a harm event. It ensures that clinicians involved in harm events aren't left alone to suffer in silence. It promotes a culture of safety and learning. It increases trust in the healthcare system. There's clearly national momentum now behind CRPs. CRPs have been named as a best practice by a host of organizations, including the Joint Commission, the National Quality Forum, Leapfrog, the U.S. National Steering Committee for Patient Safety, the World Health Organization, the 2023 President's Council of Advisors on Science and Technology, or PCAST. As Evan mentioned, CRPs are recognized in the CMS patient safety structural measures and have received strong support from the Federal Agency for Healthcare Research and Quality, or AHRQ.
We created the PACT Collaborative because we know that while the idea to support CRP may be easy, actually implementing one that is comprehensive and highly reliable is very challenging on your own. You really have to think about creating a CRP program across many different departments, creating standard work across patient relations and the clinical staff and departments of quality, safety, risk, claims, legal. With PACT, you are not on your own. You'll have an extensive suite of tools and resources. You'll be working with a faculty who are leading CRP experts to guide your implementation. You'll have a robust community of peers who can share experiences and offer support. You'll have a designated coach who will be in your corner throughout the collaborative, and you'll be following a structured developmental curriculum that's presented over 6 learning sessions.
The learning sessions are a core component of IHI's Breakthrough Series Collaborative that intersperses learning sessions where content and guidance are shared with action periods, where you're supported with implementation of what you've just learned. During action periods, you'll work with your coach to test new ideas and meet with a smaller cohort within the collaborative to discuss progress. By the end of the collaborative, you will have launched your CRP and you'll be ready to join the PACT Leadership and Innovation Network for ongoing support and opportunities to advance the field. Our learning sessions feature our core faculty from Ariadne Labs, the Collaborative for Accountability and Improvement, and the Institute for Healthcare Improvement, shown here, as well as guest faculty that include patient and family advocates, communication experts, CRP researchers, legal professionals, and CRP implementers who can share their real experiences. Our faculty are truly the national leaders in CRP implementation and collectively have decades of experience implementing highly reliable CRPs.
I'm Melissa Parkerton, Director for PACT, and we are very proud of the 40 health systems across the country that have already participated in PACT, some of them shown here, and we look forward to supporting many more. As one prior PACT participant said, the PACT Collaborative can help any organization achieve success. Whether the organization is just beginning this important work or is well on its journey, the resources provided by the PACT Collaborative are invaluable now and will continue to be so into the future. PACT is truly a mission-driven initiative. We are committed to keeping our costs low so that cost is not a barrier to participation. Our early bird pricing is available now through October 17th, and after that, it just goes up by another $4,000. You can learn a lot more at our website, ariadnelabs.org/PACT, and of course, any of us would be happy to talk with you further. So thank you for joining us to learn a little bit more about the PACT Collaborative, and please do reach out if we can offer other information at any time. We hope you'll consider being part of the fourth wave of PACT.